Hey guys, it's Dr. Ivy Branin here of Simplicity Health Associates, naturopathic doctor and women's health and hormones expert. So today I want to talk about what I recommend for patients who are trying to get pregnant, but they're not necessarily in their 40s and they don't necessarily have any major fertility challenges. This is like one of these questions that I often get from patients. Maybe I've worked with them for a while and now they're ready to start family planning. All the supplements that I am going to be talking about today, you can easily get through FullScript. If you have not yet set up your FullScript account with us, I highly recommend to go to the description of this video and click on that link. Also, that link will take you directly to all the things that I'm going to be talking about today in this video. And if you have not yet ordered from us through FullScript, you will get 10% off your first supplement order. So these are things that I often recommend for patients that are trying to get pregnant. Now, first off, you really want to make sure that you are starting any of these supplements at least 2 to 3 months prior to even trying to get pregnant. So one of the big things is because a lot of things actually happen during that first month of pregnancy, and many people don't even know they're pregnant during that period. It's also making sure that you have optimal levels of some specific nutrients that are really vital for a healthy pregnancy. So first off is a multivitamin that I love, Fem1. Why do I like it? So first off, it has the optimal amount of folate, and it's in the methylated folate form, which is the most active form. So there's many of us that don't actually activate folate, and that can be very detrimental, specifically during pregnancy. But folate is probably one of the most crucial vitamins. It's a B vitamin for pregnancy, and it's really important that you start supplementing even prior to getting pregnant. It also has iodine. So iodine is really important for thyroid function, and it also is important for fertility and pregnancy. And it also has iron. So we want to make sure that going into pregnancy that our iron stores as a mark of ferritin are optimal, so above 50. Iron is really important for preventing anemia. Also, studies actually have shown that women who have anemia during pregnancy may have preterm labor, lower birth weight, and so iron is really important. And then also the other thing that I like about Fem1 is it has vitamin D, and vitamin D is very crucial for fertility and pregnancy. And something kind of interesting is that sperm actually have vitamin D receptors. So another reason why vitamin D is really important, and you want to make sure going into pregnancy that your levels of vitamin D are about 50. The other kind of amazing thing about Fem1, unlike other multivitamins and maybe some of the other prenatals that you've been looking at, it's only one capsule. So that's only one capsule that you will need to take. And I always like prescribing multivitamins that are 2 capsules or less. So that like meets my criteria. Next up is by Nordic Naturals. It's their Pro Omega 2000D. Why do I recommend it? It has a lot of DHA. So DHA is so important for baby's brain development, but it's also important for mommy's mood, specifically postpartum. So it's going to be supporting baby's brain development in utero, also during lactation, and it's also going to be very important for prevention of postpartum depression. Then last on the list is a probiotic by Claire Labs. It's their Therabiotic Women. Why take a probiotic if you're trying to get pregnant? There's many reasons. One, it's really important to have optimal flora to prevent infection. So definitely you don't want to be getting a urinary tract infection or BV or any of these other infections during pregnancy. You also definitely, hopefully, don't want to be getting group B strep, because the big thing is we really want to make sure that you don't necessarily have to take any antibiotics during pregnancy. And many antibiotics, unfortunately, are contraindicated during pregnancy. So we really want to make sure that vaginal flora is optimal prior to pregnancy. So those are the 3 supplements that I recommend for women who are trying to get pregnant, and again, recommending about 2 to 3 months prior to even starting to get pregnant. And everything that I've mentioned in this video, you can easily purchase through FullScript by clicking on the link in the description of this video. And if you have not yet ordered from us, you will get 10% off your first supplement order. Hopefully found that helpful. And again, this is Dr. Ivy Branin of Simplicity Health Associates. Looking forward to talking to you next time.